Dr. Ellie McGregor, and I'm here with my podcast from, it's called I Heal Kids, and my practice is Middle Path Integrative Pediatrics. You can see my office behind me. If you need a holistic pediatrician from 0 to 21 and you are in or around Asheville, North Carolina, please reach out. Or if you need functional medicine and you're between the ages of 2 years and 102 years and you need help either optimizing your health, vitalizing yourself, longevity, or any chronic condition, definitely reach out to me today as well. I'm here today with Madeline Cohen of Madeline Cohen Counseling, who is an amazing therapist. And she's here to share with us all about what she does. And if you don't mind jumping in and just kind of telling us a little bit about yourself and what you do.
Hi, I'm so glad to be here. Thank you for having me. This is super exciting for me. I love to always talk about what I do. I'm super passionate about my work. And so I am a licensed counselor here in North Carolina, and I specialize in parent coaching. I've worked with parents and families and kids for 14 years, and over time, just kind of whittling down my practice and really developing my niche, I've really just loved working with parents. And I find that working with parents gives me, direct impact on children as well. So the work is super rewarding, and I'm really glad to be here.
Oh, that's amazing. Do you mind sharing a little bit about what inspired you to pursue this career in counseling, play therapy, and coaching parents?
Yeah, absolutely. So when I was 15, my very best childhood friend, her parents went through divorce. And in that moment that she told me, I saw how much pain she was in, and it just broke my heart. I just remember feeling just so saddened by it. And so I have such a vivid memory of the pain that we both experienced that day. And there was nothing I could do to make the situation better. So at that age, I didn't have the insight to know that just time would solve, that would heal. But I was determined to help kids and to make a difference. So it wasn't until I graduated college and my family business that I was planning on going into was like ripped out from underneath me. And I figured out that I could pursue a master's degree in play therapy at one of the local colleges near me. And so that is when I started working with kids.
Oh, that's amazing. And it's so poignant that you point out, the struggles with your friend, because divorce can be such a trying time for kiddos in general. Even in amicable, type circumstances, it can be quite jarring to their nervous systems. It can really affect their vagal tone. And as we know, in functional medicine, stress creates a situation where it suppresses our immune system, and then we can have issues with our health physically as well as those mental health concerns. So it seems like even at a really young age, you were just such an empath and you were just wanting to help so much. And then that inspired you to get the skills that you needed to do professional work. Yeah?
Yeah, absolutely.
For those who are not familiar, what exactly is parent coaching and how does it benefit kids?
So it just depends on who you work with. So parent coaching will look different with each professional that you hire to help you with parent coaching. But for me specifically, I work with parents to become more connected to their children. And I do that because I believe that that connection is the foundation of healthy development for the child. But this day and age, there's so much that gets in the way of the parent-child connection. So I work with parents to understand what's getting in the way and and then I help them to remove those barriers. So some of the common barriers that I see are intergenerational patterns and trauma, burnout, distractions like devices is a huge problem. And then ultimately just being disconnected from our own selves.
I love that you bring up like ancestral history, because I think it's a piece that in the past we may have overlooked as professionals or not thought much about. Yeah. But I'll say from my perspective, we're really seeing those epigenetic changes in the DNA. So we're actually seeing DNA changes due to generational trauma. And you may know more about this than me, and correct me if I'm wrong, but I think I've heard the statistic that it can take up to 4 generations to heal a major trauma genetically. We'll have to fact check that.
Yeah,
But
yeah.
But in any case, it definitely seems to pass, not just through the physical body, which is so interesting, but also through behaviors that we're either conscious of or unconscious of, or engaging in a way that we may not, notice as having an effect that we might not want on our children. Now, you have had a health journey yourself recently, and I was wondering if you would feel comfortable sharing. The reason that I'm bringing it up is because many parents, I think, look at health professionals in general, and we are a beacon of hope and a place where we can hold space for people and be there. And we have our lives outside of this career that we do as well. And I think that sometimes there's a disconnect between what people see in our work and what's going on behind the scenes. And it's interesting because I think it actually enhances our work because of the journey that we go through separately in our personal lives. But people don't always get to see that. And I was wondering if you'd be willing to share, because I think it's important for people to kind of know, yes, your health professional has experiences outside of just this meeting and they can relate on other levels.
Yeah, absolutely. So about a year ago, I was diagnosed with a type of cancer called mucosal melanoma, which is a super rare and aggressive form of cancer that occurs in the mucosa regions of the body. So it was in my nose, but a lot of times it's found in older adults, and they usually catch it too late because it's not visible. It's in the internal tube that runs through the body.
Oh my gosh.
And so I was just really lucky that it was like basically sticking out of my nose, and I could see it. And so I was diagnosed really early and treated for that over the last year. And so I'm coming off of taking some time off, which is why I have a lot of availability in my schedule to get back to work and help people in the community. And so, but that, taking that time, basically it was a huge wake up call for me to start practicing what I preach and get back to a lifestyle that I know is necessary for longevity. And then, so managing stress, focusing on diet, making sure that my sleep is good. I also happen to have two, at the time I was diagnosed, my girls were turning 1 and 2. So I was like,
so you're in the
I
thick.
still feel very much in the thick of it, but I was very much in the thick of it a year ago. And so, it was just a really challenging time, but I was very fortunate to be able to take the time to reconnect to myself and reconnect to what I know is, right for how I should be living. And I really believe that is what's going to keep me strong and alive for a long time.
And I want to circle back to this because I do want to ask you how you feel it's informing your current practice. And I also just want to comment that this is such an interesting point that you make for patients in general, or people in general. Myself, I went through a health journey where I was diagnosed with an autoimmune disease, which was quite trying. And even as a health professional, very difficult to get a diagnosis. Some dismissive things happened where people said that I had depression and all of this. And I was like, no, I actually have symptoms. And eventually I was able to get that diagnosis. And now I notice that I'm very protective of my sleep, of the food that goes in my body, of my boundaries, where I may have been a little more lax before. And I think the reason I'm bringing this up is just because I see this with parents so often that, oftentimes, understandably, we want to give everything to that baby, that child in front of us. And then, 10, 15 years later, it's just burnout city, and it just plagues on our mental health, on our physical health, on our interactions with humans, the way we socialize, and all of that. And that's a lot of the work that I do, is kind of unraveling that and unteasing it with functional medicine, especially with adults. So wake up call, anyone out there who has not yet had a health journey, please start taking care of yourself now.
Yes.
Especially if you have young ones, or even if you don't, start unraveling some of that. If you are, kind of putting your own needs to the wayside, please refocus, because two health professionals here today to tell you it is so important. And, don't wait to have a health scare. But Madeline, I did want to circle back to how this has informed your practice. What do you think about that?
Well, one thing I want to kind of share with you about what you were saying is one of the things that I have my friends and family and everybody that I encounter that I tell this story to asked me, like, how did you get through this? Like,
Hmm.
how did you just not lose it? And I was like, first of all, I did lose it. Okay.
Yes.
I did. But
Yeah.
one one person, I don't even remember who told me this. I was probably one of my healers, now that I think about it, told me, who I actually had hired because she did also went through cancer recently. But one of the things that was comforting to me was that we're actually all in the same position, and that we don't know how close we are to death unless one of these tragic diagnoses come to you. And so this is speaking to all the people that, feel healthy and that are, feel invincible, right? And that it's just not even a thought in their mind. But in fact, we are all in the same boat. We all don't know whether we're going to be here tomorrow. And some of us are just closer to knowing that this life is not permanent. And so that, even though that might seem kind of dark or tragic, it was inspiring to me in that moment of feeling like I was like isolated and alone with this diagnosis, even though, like, there's all these groups and all these support and everybody comes out of the woodwork to support you and blah, 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 blah. But, ultimately, just knowing that, like, we're all in the same boat, and we have today to make the choices to make a difference in tomorrow.
Hmm.
That's
Hmm.
it.
Yeah, it's so interesting. In my world, I see a lot of diagnoses and outcomes and things like that. And
Mm-hmm.
even then, it took another experience, right? So, but I will say, I think that being a patient is different, right? So, being a patient, going through that journey, it gives you a different lens or different optics on the health system at large and like what people are coping with. And I think, in your role in particular, understanding and having that perspective of, parents have all these things happening, their job, their ancestral life, their diet, their, whatever capacity people have for sleep and rest and, or none, and so there's all these different threads that are being pulled. And you having been through that, I think as a coach, you're able to kind of see that webbing and understand it more fully and deeply to where you can help people more.
So just to answer your question with how it impacted my practice, basically, is that although I knew this was important prior to my diagnosis, it became so much more relevant to me was restoring and toning the nervous system. And I know we can talk
Mm-hmm.
a little bit more about that later. I'll talk more about that later. But that has been a huge focus of my work with parents as well. I've added that in as a really key component to helping parents get to the place that they want to go and meet their goals.
Yeah, I mean, so important for, like we were talking about before, the immune system, stress levels, the way that we react. That vagal tone is so important. We are going to jump into that more later, but I wanted to kind of just go back to your earlier story because I was
Mm-hmm.
very interested. I noticed you had mentioned that you'd studied under Dr. Gary Landreth, and I was wondering what that approach was, how it shaped your approach, what working with this person was like, and just your journey from the beginning.
Sure. Well, so I will tell you that I was so fortunate to take my introduction to play therapy with Dr. Gary Landreth. And he's known as the grandfather of child-centered play therapy. And I will tell you, that was the hardest class of my entire master's career. I got the
Okay.
worst
Okay.
grade in that class, even though it's my specialty, because he is one tough cookie, I will tell you.
Tough
But he's
guy. Okay.
amazing. He's
Yeah.
amazing. He's just like the most, but it's so funny because he's like the most gentle soul you will ever meet. Just like
Uh-huh.
sweet as can be, and then just like tears apart your paper. And I'm like, oh God. But anyways, so what's significant, I think, about what he believes is that children, and of course all humans, have what they need within themselves, this innate capacity to grow and heal, but they have to be given the right environment to do so. So to provide that environment is the parent's responsibility. And that's where I come in to help parents cultivate that environment that's in line with their values and so that they can feel proud of what they're creating. But also what that really means is that each individual is the expert on themselves. And so I just have to follow their lead. And sometimes they just need to be reminded that they're okay just the way that they are.
If you've never seen play therapy or heard about play therapy,
Mm-hmm.
it may be hard for some people to kind of visualize what that looks like. Do you mind kind of explaining, what like a typical play therapy
Sure.
appointment would be? Okay.
Absolutely. Yeah. I mean, so I'm not practicing play therapy anymore because all my practice is fully online, but I practiced it for
Yeah.
years and I have wonderful referrals for play therapists that are really talented. Play therapy, a lot of people do play therapy or say they do play therapy, but they weren't necessarily trained in play therapy and they just like to use play in their sessions and call it play therapy, but that's not what play therapy is. Play therapy is a very specific set of toys that are based in real life experiences. So a typical playroom would have a kitchen and dress up and puppets and arts and crafts, and then a whole other assortment of aggressive toys and, expressive toys, emotional toys. But basically what happens is that the child comes into the playroom and the play therapist is there to basically hold up a mirror and to show the child what they see. But to come from an attitude, an expression of acceptance and compassion so that the child then starts to become more accepting of who they are and what they're going through. And so
Yeah.
play is the natural language of the child. And so they will play out and express themselves, whatever's happening in their life, through their play. And so in play therapy, a trained play therapist is looking for themes and patterns in play to gain a deeper understanding of what's going on internally for the child. And then they also will share that with the child and reflect that. So while the child is playing and it's unconscious, the play therapist then brings that awareness into consciousness for the child. And then that allows them to go deeper and to process what's happening inside of them. And so the byproducts of play therapy are an increased self-esteem, increased ability to express oneself. And it, obviously it also helps with relationship building skills as well.
And so I'm seeing how all of this background that you have like now informs the work that you do currently where you're helping parents online. And so how does that look? Like, what does that look like when a person comes to you? I know we
Mm-hmm.
talked before this about helping people regulate emotions and improve parenting, things like that. But
Mm-hmm.
maybe you could just kind of dive into like what an appointment looks like with you.
So typically when a parent comes to me, they're usually burnt out.
Yeah.
And there's lots of reasons why they're burnt out. And so first we have to determine what all those reasons are. So we're going to look at, sensory input. We're going to look at trauma history. We're going to look at current relationships and intergenerational patterning, of course, as well. So, the history that they have with their parents and parents and all that stuff that gets trickled down, like we were talking about earlier. So first we're going to determine what's contributing to the burnout so that we can create a plan for the parent to start feeling better as soon as possible. And once they're feeling better, or not once they're feeling better, but once that plan's in place, then we'll start looking into the parent-child relationship and determine what are the dynamics that are going on in the parent-child relationship that are causing the breaks and start, using intervention to repair those breaks. And a lot of times what I see is that the parents that when we repair the parent-child relationship, that any behaviors that were troubling to the parent are reduced.
I think it's interesting that you're talking about burnout specifically. It seems to be the theme today, and I'm glad that it
Yeah.
is because it's so important. I think, at least I'll speak for myself, I notice when I am working too hard or I didn't prioritize my, health, even something simple like I didn't drink enough water and I'm thirsty. I notice
Mm-hmm.
I'm not able to regulate as well with my emotions. And I might be
Yeah.
irritable, like, with my
Mm-hmm.
husband or, kind of fussy on the phone. And I'm like, oh, I just have to get off the phone. So I imagine that as a parent with so many overwhelming responsibilities, learning to regulate emotions would really help. And so, can you explain why this is so important for the parent child relationship specifically?
Sure. So When a parent's emotions are dysregulated, they're overwhelmed by their own emotional experience. And if they're overwhelmed by their own experience, then they're not able to be present with or teach the child how to effectively process their emotions either. So
Mm-hmm.
this leads to overwhelm in the whole family system, and usually miscommunication, misunderstanding, and ultimately disconnection between the parent and child, because being in connection is too overwhelming. When the parent's emotions are regulated, the parent has the ability to meet the child's needs more effectively, which encourages safety and connection in the parent-child relationship.
Yeah, that's so interesting because, I notice in my work, for example, I'll just speak to infants because it's what comes to mind. I notice how much connection there is with the infant and the caregiver. Often, if we're able to bring it down, take a breath, lower our heartbeat, you'll just see the infant
Yes.
melt. Alternatively, on days that we're more frazzled and don't quite have, maybe we're late or don't quite have the capacity that day, you'll see the infant ramp up. And it's just such a dyad. I think it's impossible to separate the two. So it's almost interesting. I like your approach because we're no longer separating the family members. So it's no longer well, the child has therapy. And then maybe mom needs therapy at different times, and all of this is it's addressing the interconnectedness of the energy between people, which is so
Yeah.
important. So self-parenting must be huge in this part of the process, just kind of reparenting ourselves. What does that
Mm-hmm.
exactly mean anyway? Because sometimes it's almost well, we throw these words out like self-parenting and you're well, what is
Yeah.
that? And then on top of that, how can parents even start this process to support, themselves and their kids?
So even though our parents did the best that they could with what they had, or at least that's what everybody says, right? There's
Yeah.
very likely times and experiences that we had as children where we didn't get our needs met. And so it's our job, once we become adults, to recognize those unmet needs and begin to meet our own needs. And so some people in my industry call that reparenting or self-parenting, where we recognize the needs of our own inner child and that they're still relevant and still present. And then we can actively work towards healing any hurt or trauma that's interfering with our ability to show up as the best parent that we can be. So the first step would be to notice and then be curious about our emotional reactions when they come up. So using curiosity and kindness towards ourselves instead of judgment and avoidance will allow you to learn more about what's happening inside of you and why it's there and where it comes from. And once you have a better understanding of your needs, you can make choices that honor yourself, because ignoring those needs is actually a huge betrayal of self and usually results in repressed or suppressed emotions. And that
Mm-hmm.
can just make a big old mess.
And I would imagine that would come out in all kinds of different ways. For me, I'm thinking about even kind of simple things like, do I have the right to take an hour off of work to go to my doctor's appointment? Or do I feel empowered to go to the gym or skip the gym, depending on how I feel, and not necessarily having any judgment about that, like I'm lazy or a bad person or any of this. Instead, kind of thinking, well, my body's exhausted. I just need to go home and rest. Or,
Mm-hmm.
alternatively, oh, I really need to work out and just kind of get some things out, or, it would be enjoyable or fun. So just kind of thinking through some simple things like that. Although I
Mm-hmm.
know your work goes a lot deeper than that as well. What are some key principles of your work that can help families thrive?
I mentioned it a little bit earlier, but one of the first things that I work with is regulating their nervous systems. And so, you know, that just involves a lot of history, going over the routine, sensory input, like I mentioned, emotional regulation, what are they doing? Like, how do they normally respond to their own internal processes? And then helping to correct that,
Okay.
and helping them become more effective and efficient at processing their own emotions so that then they can pass those skills down. And so, you know, once there's a plan in place to help them address all of these issues, then we work on, repairing the relationship of the parent
Okay.
and child.
Hi everyone, Dr. Ellie here, jumping in just to let you know we're going to be doing part 2 with Madeline Cohen, who is a licensed clinical mental health counselor and coach for parents seeking to break generational patterns to parent with skill and ease. So in the next episode, in part 2, we're going to be talking about understanding the difference between big T and little t trauma, parent patterns and their impact, the fight, flight, and often overlooked fawn response, which is people pleasing in parenting, EMDR, which if you're not familiar is a path to healing to heal generational trauma and other traumas, practical tips for overwhelmed parents, and finding support if you need it. So we'll figure out who could benefit from coaching, who needs Madeline's help, and where to find her. So if you're interested in that, head on over to part 2 of this podcast. All right, wishing you well.